The governor did not make any major changes to the Safe Start plan, but today did take some steps to minimize large gatherings as a way to stop a rise in cases, deaths, and hospitalizations across Washington. He also warned that more restrictions and rollbacks could be coming if the spread of the virus can't be brought under control. Here's what we know right now. The state of Washington is averaging 629 cases a week, the most cases since the outbreak began. Some of that is due to more testing, but the data also shows the cases are outpacing the testing. Spokane County reported 95 new cases today after nearly 97 new cases yesterday, and 107 more people have been diagnosed with COVID-19 in the northern counties of Idaho. 4 News Now's Maher Kawash is live tonight with what this path forward means.
Back in the start of this pandemic in March, Washington was considered the epicenter of COVID-19, with 42 of the nation's 66 deaths. Now, 4 months later, Washington ranks 27th in the U.S. in deaths per 100,000 people. Now, that's good news, but Governor Inslee says it won't last if people don't follow these restrictions. As COVID-19 cases surge across Washington, Governor Inslee is hammering down on social gatherings to slow the spread.
We simply have to find another strategy or additional strategies to arrest this pandemic.
Counties under Phase 2, which account for 85% of the state, are still limited to gatherings of just 5 people. The change comes for counties under Phase 3, as people there can only gather in groups of 10 now, compared to groups of 50 before. Inslee is also banning all live indoor and outdoor entertainment for the entire state.
If we are going to reduce movement of people and cut down on the number of face-to-face contacts, these are necessary and reasonable decisions that we have to make.
Spokane County's rise in cases has state health officials concerned, partly because of community spread. The orange line you see declining here represents COVID-19 cases that are linked to previously known cases. That's a good thing, but that makes up just 46% of new cases in the county. The others are spreading in the community or still unknown.
The disease is now most commonly spread at social gatherings, face-to-face meetings.
Now Inslee is worried about a rise in COVID hospitalizations. Here in Spokane County, 36 more people have needed emergency care in the last 2 weeks. Local health data shows just under 50% of people hospitalized with COVID-19 are ending up in the ICU. Health officials say about 60% of all hospital beds in the county are being used right now, 4% of which are for COVID patients. Delays in testing and contact tracing are still causing a serious problem across the state right now. In Spokane County, it's taking at least 10 days for people to get their test results back. I'm told the issue is the testing labs that process the tests. They're all jammed up. Aaron?